Now it is my distinct honor to introduce our commencement speaker, Jodi-Ann Burey. Jodi-Ann is a sought-after speaker and writer who works at the intersections of race, culture, and health equity. Importantly, she's also a proud alumna of the University of Michigan School of Public Health. Jodi-Ann earned her MPH in the Department of Health Behavior and Health Education. I think I hear some go HBHE. Her TED Talk, The Myth of Bringing Your Full Authentic Self to Work, embodies her disruption of traditional narratives about racism at work. Jodi-Ann is also the creator and host of a podcast, Black Cancer, that talks about the lives of people of color told through their cancer journeys. And she is currently working on her first book. So I'm thrilled to have her here with us today to address our graduates. Please join me in welcoming Jodi-Ann Burey.
Thank you so much for that introduction, Dean Bowman. Good morning, everybody. Good morning. Listen, I come from the Black church tradition. Good morning, everybody. Good morning. Thank you. I want to start by acknowledging and thanking the coordinators, the volunteers, our custodial team, the AV crew, our photographers, our decorators, the interpreters, and others who often remain unnamed, but whose work makes this space possible. Thank you to Provost McCauley, faculty, and staff. Welcome to all the friends and family here with us today, including the crying babies, okay? They are part of our families, and they are part of our future, and they are here supporting our graduates too. Your graduate might walk across this stage alone, but your love, support, and cries have cleared their path. Thank you for your irreplaceable role in this community. And of course, to the class of 2024, thank you. Your unwavering, yes. Your unwavering commitment to improving health and saving lives is truly the only reason any of us are here today. On the heels of the pandemic, while so many folks around the world clamored to get back to normal, each of you came here. Perhaps some of you came to advance your already established careers, and for others, you came here to start one. Either way, you came because you believe in the core value of this discipline. Every body has the right to good health. As your guest speaker, my job is to share a few encouraging words that, at best, serve to usher you into this next phase of your career, or at the very least, linger in your hearts and minds for the few minutes we have together. As an alum of the University of Michigan School of Public Health, shout out HBHE. Okay, you know, we love it. It is my duty and honor to welcome you as soon-to-be fellow alumni and colleagues in this sacred profession. This is the job normally. But graduates, these are not normal times. Social safety nets continue to fray. Mass gun violence proliferates unregulated. Reproductive health care stripped away. Doctors and patients facing legal action for basic care. Targeted segregative policies hoard clean air, clean water, fresh foods, and safe green space for the whitest and wealthiest among us. Rising income inequity pushed families out of their homes. The climate crisis still somehow being debated. Draconian, anti-history, anti-critical thinking, anti-books, and anti-health policies leave communities isolated from life-changing and life-saving support. One thing every single human being in the world has in common is that we all have bodies. And perhaps, despite this increasingly dividing political culture, the right to good health ought to be where we find common ground. Graduates, do not be mistaken. Public health is not neutral. In policy and in practice, we have deemed some bodies deserving of good health over others, some lives worth saving over others, some people more human, more dignified, more decent than others. In this country and across the world, people have created systems that reserve the right to good health for some and not others. Leaders at this university have decided that divestment in solidarity with Ukraine is more moral and more urgent than divestment in solidarity with the Palestinian people of Gaza. We are witnessing the most well-documented genocide in human history on our cell phones. Every issue you came to SPH to dedicate your career towards, maternal health, infectious disease prevention, non-communicable illness, mental health, food security, healthcare systems, humanitarian aid, is at a point of crisis in Gaza. Who you are, what you look like, where you live, and how much money you have determines whether your right to a healthful life is respected or ignored. Public health is political. As public health professionals, health equity is our only goal. It is mathematically and morally impossible to fulfill our mandate that every body has a right to good health if we leave Black, brown, queer, poor, migrant, women, trans, refugee, elder, non-binary, rural, sick, and disabled people behind. Earning your degree in public health is a momentous achievement, but graduates, it is also your debt. I'm not talking about student loans, though there is that. I'm talking about what you now owe to the community, to the public around the world. And so, instead of words of encouragement, I thought I'd offer a few considerations. First, doing good work does not make you a good person. In public health, snap it up. In public health, we are helping professionals. We are the ones who save lives, not just individuals, but populations, not just right now, but for generations. We are the ones who help read, write, research, legislate, teach, and innovate on behalf of the public good. This makes us vulnerable to a kind of psychological bargaining where we think that our good work over here cancels out our bad behavior over there. Our values may begin to slip. Just because we work towards food security doesn't mean we can create a hostile work culture. Just because we deliver vaccines doesn't mean we can pressure community members for their stories or their photos. Just because we're working towards reforestation doesn't mean we can turn our eyes away from the land use crisis from large data centers. We know from our training that information alone does not change behavior, but we have the power and the responsibility to create systems that motivate change towards health equity and justice. Second, do not become the problem you're trying to solve. Many in the generation who claim to have walked with Dr. King now lead and legislate against our civil rights. In an effort to secure our careers, we too might become barriers we once sought to tear down. We may know that programs are ineffectively designed and do them anyway because that's what the funder wants. We may form unnecessary committees that stall decision-making. We hoard resources. We discriminate against projects, patients, and populations that do not serve the bottom line or meet our desires for status. We pick the same low-hanging fruit again and again because it's simply easier or cheaper or faster. Graduates, this does not have to be your fate. Each year, perhaps on this day, May 2nd, I encourage you to set aside time to inventory your actions, recommit yourself to the audacious vision that led you here. Third, everybody's business is our business. It's been 10 years since I've graduated from SPH. I spent 5 of those years working in international development, then spent the next 5 pursuing other seemingly non-health related professional paths. To an outsider, my work is no longer legible as public health. But when I write and speak about racism in the workplace, I do so because public health is how I know about weathering, how chronic stress corrodes our physical and psychological health. Health and health equity is the lens through which I see the world. It's how I know where to belong. Once you have this training, graduates, you can never go back. Everything you do is public health. That is how you pay your debt. Graduates, confront the limits of your imagination. Over the past few weeks, I found myself returning to the words of poet Audre Lorde. When I dare to be powerful and use my strength in service of my vision, then it becomes less and less important whether I am afraid. Graduates, you are powerful. And if you don't feel powerful, know you are privileged. Your strength comes from your training, but most importantly, from this community. As a group of folks who spend all day talking about parasites and pandemics, I know you are not afraid. But I want you to ask yourselves, what is your vision? Audre Lorde said, when I dare to be powerful and use my strength in service of my vision, what is the vision you will be in service of? Who are you visioning with? There's a stubborn idea that being a student insulates you, protects you. In the past few weeks, it has never been more clear that these institutional protections are fraught at best. From the civil rights movement, anti-war protests for Vietnam, or protests to divest from South African apartheid, from the DIAG, to thousands of protesting across the country, and now on every single continent on the planet, raising their voices and laying down their bodies in solidarity with Palestine. History has always been on the side of students because students have the power, strength, and courage to put their values into practice. Do not lose that fervor once you cross this stage. Community, not institutions, protect us. Students protect students. Workers protect workers. And it is in community where we can learn to push our imaginations, to envision and build a better, healthful, equitable future. As you leave campus today, I want to remind you, graduates, to whom you belong. You belong to yourself, to your values. You belong to each other, your loved ones surrounding us today, the students sitting next to you right now, those who will be sitting in these chairs next year. You belong to people who know your name, and the millions more who never will. My vision for you graduates is that you keep the people who you dream with. Find more people to build with, who together can turn public health challenges into public health possibilities, not just for some people, but everybody. I am rooting for you, and I am building with you every step of the way. Congratulations to the class of 2024.